Let's move on now to an issue which is a constant gripe for many of us, making an appointment to see our doctor. Rob Whitehouse has been looking at a radical new scheme in Leicestershire which has the enthusiastic backing of patients and GPs.
The tension and hassle of the GP waiting room is enough to send your blood pressure rocketing. And that's before you've even got to see the doctor. But this medical centre at Thurmaston in Leicestershire think they've come up with a solution. It's called patient access. The patient calls the practice, the call is logged at reception, and the doctor then calls the patient back. They're then booked in, diagnosed and advised over the phone or sent for tests. Easy.
We realised that we were seeing the patients who actually needed to be seen, and were able to advise patients with very minor illnesses who didn't need to be seen on the phone. Tell me a little bit more about your sleep. Are you actually getting to sleep?
I'm actually struggling to get to sleep.
I'm not getting sleep till about 4 o'clock in the morning.
Wendy Coltman suffers with depression and finds the new system really helpful.
I did have days where I didn't want to leave the house, so being able to speak to the doctor in the comfort of my own home is a lot better.
What's this new system meant for doctors?
It's actually made a huge difference to our day-to-day work in that it flows much better. We can control our time much better. And the consequences of that have been that we've been able to reduce patient waits.
So far, 40 surgeries around the country have taken up the scheme, run by Harry Longman. An engineer by training, he was attracted by the innate simplicity of the system.
The patients love it because they can be speaking to a GP within minutes, not days. If they need to see the GP, they'll be offered usually the same day. The GPs love it because it helps them to manage their workload better.
That's good because you get your diagnosis fairly quickly. If you have to get a booking, then they give you a booking.
Helps me a lot really because I live a little bit out in the wilds.
If he says I want to see you with Evan the same day.
The scheme here has been running for about 8 weeks, but about 9 miles away in the village of Quorn, a similar patient access programme has been in place for much longer.
I think it's definitely the right thing to do. We would never go back because of the patient feedback that we get and the benefits that we see as doctors.
In those areas where they've been operating the telephone system, they've found attendance at A&E has dropped by 20%, and the number of patients who fail to keep their doctor's appointments has fallen dramatically.
We can't see a reason why everybody wouldn't want to do this, which is why we're talking to people all around the country.
Under the old system, patients could get angry, get fed up of waiting, and end up missing appointments. Now the days of losing patients, in more ways than one, may be over.
So it seems such a good idea and such a simple one too. And you can see that patients clearly like the idea of it. Do you think we should all be getting the chance to benefit from a scheme like this, Liz Kendall?
I think it looks like a fantastic scheme because it's giving patients quicker, easier access to their GP, either on the phone or in person, but it's also reducing the number of patients who turn up at A&E. I think that we often focus a lot on what's happening in hospitals, but 90% of people's contact with the NHS is in primary care. It's really important, with all the problems we face with our hospitals, we don't lose focus on GPs. They have a massive role to play in ensuring people get the right care at the right time in the community.
Okay, well, as you say, accident and emergency cases are down. People get to see their doctor on the same day if necessary, and fewer people are failing to turn up for their appointments in the first place. Surely this is the sort of thing that should be rolled out across the region, if not the whole country.
Well, first of all, I absolutely agree. It's clearly a very good thing for those patients, and indeed for not just for the patients that are seen, but the whole generality of patients, because it means that resources are being used much more effectively. So it's a very good scheme. I do think there's one word of caution, which is that the whole history of the health service is peppered with examples of people developing good ideas, demonstrating that they're successful, and then the health service tries to make it universal in a whole series of circumstances.
So you want to see how it works a little bit more before
the true lesson, not so much that, the true lesson here is that when people have a problem and solve it, they should be empowered and encouraged to get on and do it. The solution will quite often look slightly different in different communities.